Hey guys, so I wanted to get on here and talk to you about, let me put it in the comments. We're week 2 of the government shutdown. We're at week 2 of the government shutdown. All right. And I wanted to talk about what that means. Week 2 of the government shutdown. I want to talk about what that means for home care, home health care, what that means for you. If you are a home care business owner. And as you are logging in, please let me know where you are watching me from, all over the world, all over these United States. Okay. So I have a couple of updates and then we won't be on here long because I do have my home care home care Kickstarter mentorship tonight and my next step home care mentorship tonight. Okay. So again, let me know where you're watching me from. Number one, if you are an aspiring home care CEO, not quite licensed yet, give me the number one. Give me the number one. If you're not quite licensed yet, haven't submitted your license, not completely operable, give me number one. Number two, if you are an existing home care business owner, give me the number two. And just let me know where you're watching me from. I'm going to move a little fast tonight just because, again, we have our regular mentorship session tonight. And I am going to finish getting ready, but I have been meaning to give another update on how or if the federal government shutdown affects home care, home health care. And if you want to see the first part one of this, then please go over to my Savvy Business Chick YouTube channel. Okay. So first, for those who don't know me, my name is Sean, aka the Savvy Business Chick, the original home care business mentor. I'm not a gatekeeper, so I purposely get on here on TikTok, on Facebook, on YouTube, and on Instagram. Instagram sometimes doesn't make it very, very easy to get on live just to share what's going on in the industry, right? It's almost like let's have a cup of tea, let's have a cup of coffee. If it's morning, we're having a cup of coffee, having a cup of tea, you know, having a glass of something, right? While we talk about what's going on. And one of the things I try to do is to make sure that you are well informed. Hey, how are you? Why? Because I always say this is the most tight-lipped industry. See, people don't talk in this industry. People don't share in this industry, right? So when you find someone who is sharing and who is genuine, then someone like myself and some of the people that I associate with, take that, don't take that lightly. There's a lot. Oh, congratulations. Congratulations. Proud of you too. There are a lot of people who um have made it, but they're not really here to help you make it, right? And so God bless the child that has his own. God bless the child or the woman or the man who knows how to continue to search out for the information they need to make themselves successful. So that was I don't know what I was doing with that commercial break, but I just want to start by saying, hey y'all. Okay. All right. So last time we were talking about the government shutdown. The government shutdown started on October 1st. If you're following me, put October 1st in the caption, October 1st. You guys know that every time you engage, whether you're putting comments, hearts, sharing, that helps my live, right? Helps my live. So I don't mind asking, right? And guess what? There's someone, because there's so many gatekeepers out here, there's someone trying to figure out what's going on. And if they were able to find this live, right, then they can figure things out, because on TikTok it doesn't save. Thank you so much. But that's why I'm going to leave this up on my Savvy Business Chick YouTube channel. All right, so we all know that Congress hasn't passed a budget yet. I'm personally located in the DMV, which stands for DC, Maryland, and Northern Virginia. And so in the DMV, I see what's going on. I have family members that are affected, top level, you know, top secret clearance, in the federal government. I know a lot of people that are affected by the federal government shutdown. But as for me and you want to know, well, how does this affect my business, right? And these are really, really good questions, because I don't know about if you guys have looked at it like this, but if you started a hair salon, right? If you were selling a digital product, heck, if you are on TikTok shop and you are an influencer or a creator, right? You might be able to say, I don't know, this government shutdown may not affect my coins like that, right? But because we are a regulated industry, one thing that my mentor that got me started in this business is that she taught me to always be checking what's going on in the political and the bills that's being passed. All of those things affect us, right? All those things affect us. They can affect us in a negative way and they can affect us in a positive way. But guess what? Either way, Republicans or Democrats, right? People have a need. So I want you to remember that whether there is a Republican president or a Democratic president, people have a need. So I want you to be mindful and be hopeful that our business, our industry is not transactional. Can you put that word in the comment? Our business, our industry is not transactional. People are not going to just go out and buy some hair oil one time, be like, oh yeah, that it worked. I might buy some more later on. No, people need us. So I want you to remember that. I also want to get into your mindset, on this short session. People need us. Our business is not transactional, right? And I don't think people tell you that enough. Our business is not transactional. And I had that confirmed recently by a private equity company. I have someone that is a partner with a private equity company. And if you don't know what a private equity group or company is, put that in the comment and I can explain it better. Thank you for sharing. Essentially, these are people who buy or fund businesses. This private equity group, they say, hey, Sean, I know you help home healthcare business. Do you know anybody that's selling? Right? Do you know anybody that's selling? And I said, oh, well, I can see, I'm desperately making sure that none of my mentees are throwing in the towel. And when I said, well, I already know why you're interested, right? Because it's not my first time getting contacted by a private equity group. I said, can you tell me why you're interested in home health care? And they just started breaking down the facts. So before I go over these quick tips about the federal government shutdown, let me spit them off to you. Let me read you your industry's resume, whether you are getting started or you're already started. Number one, she said, well, it's not transactional. They're looking at your business as not transactional. They said people need these services. People need these services. then they said, well, looking at the average household, people aren't having as many babies as much anymore, but the the demographics are saying that there are more older people. Remember how I keep telling you guys about the senior tsunami? Thank you so much, Susanna. Remember I keep telling you guys about the senior tsunami? They're looking at that and they're saying, oh yeah, there's more seniors than there are younger people, and they have needs, and these needs aren't transactional. So they said, and just based upon the numbers of how well home care agencies are doing, um, we're very interested in buying up home care agencies, right? So I mentioned this to someone in the Miami, Florida area, help them start a home health agency. So this is a home health agency, and but this part is non-medical, right? So we do 3 licenses in Florida. Long story short, because the private equity group says, oh, well, do you have this version of Medicaid, right? And I said, no, because essentially they said, we would give you more money if you had this version of Medicaid. And that got them to thinking, hey, maybe I'm throwing in the towel too early, right? So I'm saying all this before we talk about the federal government shutdown updates, because I'm just going to boop, 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 boop through this, because someone that I was sharing this in my story, someone that you're around, that you've been listening to, is tainting you. It's tainting your thinking. It's making you doubt, did I do the right thing by starting this business, right? Because as soon as you start, there's a federal government shutdown. And then there's the one big beautiful bill. Someone is saying, are you sure? Are you sure? And don't let you tell them that God told you, right? Are you sure? Are you sure? And if you think all your ducks are supposed to be in a row and things are supposed to be perfect when you're starting, sorry, this isn't that industry, right? There's always ebbs and flows. There's always ebbs and flows. But this is the industry. This is the business outside of like a real estate, where wealth is really created. And I'm not selling you any kind of dreams or anything like that. I'm telling you, me, born and raised in Washington, D.C., the youngest of 7, no entrepreneurs in my family. No entrepreneurs in my family. It took God sending an outsider to tell this very high performing young woman who graduated from college, who just so happened to have experience in sales and marketing. Someone helped me to make that shift in my bloodline and my family line to be the first multimillionaire in my family. And God can do it to you. God can do it for you. Okay, so here it is. Government shutdown started on October the 1st. Congress still hasn't passed the bill, guys. But guess what? It's still running. I'm going to read you guys' comments in a second. Medicare and Medicaid are still operating, right? So isn't that interesting that with all of these things shutting down, Medicare and Medicaid are still operating. So claims continue to be processed, right? God told you this is your ministry. Yes, it is. And I am one person, Kelsey, that believes that business is a ministry if you're doing it, right. What are we teaching? Can you see the banner? Daily dose of home care wisdom. Okay. Many federal agencies like HHS, CDC, CMS, admin teams are on reduced staff. So, okay, so CDC, right? Um, that's where they're doing the reporting of like infectious diseases, and they would even report things on like how many deaths according to different disease states. CMS, that's where we get like our billing information from Medicare. They're on reduced staff, right? Reduced staff. Okay, non-essential operations like the grants that some states or some programs might get, um, those have been paused. Research funding has been paused. Hey, those were paused before the government shut down. And any waiver of renewals have been paused. In fact, we have seen since the October 1st that what has been paused as far as a waiver, right? One is the hospital at home waiver. This is a waiver that I have been watching and I really like because it was opening up a lot of doors, and still will be after this is all goes away, for cancer care programs. Cancer care programs. This is something that me and my mentees in my end of the year home care marketing bootcamp are heavily working on this month. Why? It's Breast Cancer Awareness Month. And even though there is cancer, someone can get diagnosed with cancer any month of the year, any day of the week, right? This month, Pink October, is almost like Lionel Richie, for cancer. It's just it's like the Lionel Richie's like the Beyonce, it's like stepped away, Lionel Richie stepped away from the Commodores and he became Lionel Richie. Beyonce stepped away from Destiny's Child. She became Beyonce. That's what breast cancer has done. There's no other cancer month that gets this much recognition. So the hospital at home, especially in states like Texas, oh, the grant has not been renewed, but it will be renewed because it has definitely shown that it's cost effective. It's been helpful. So I do see that being renewed once all of the dust clears, right? But not that will be considered like a non-essential um, waiver that didn't get renewed. That's within the budget, and also some telehealth waivers. Now, let me give you a little tip here on the telehealth waiver. Okay, Erica, what state? The telehealth waiver, if you are an existing home healthcare business owner, with the telehealth waiver being paused right now and hasn't been renewed, this is advice I would give to my mentees. Actually, I've already given to them 2-3 weeks ago at the start of the home care marketing boot camp. This is a good time to try to get some of those seniors to their doctors. Why? Because they can't, because the doctor's not doing a telehealth visit, right? Isn't one of your non-medical services to accompany them or take them to the doctor's appointments? Now you got a reason. You got a clear reason here. The government shutdown is giving you a reason to market that. Okay. All right. So anyway, so telehealth waiver. Okay. So what is a telehealth waiver? Expanded Medicare telehealth access during COVID-19. All right. So telehealth, where you can have a virtual visit with the doctor without having to go into the doctor's office, kind of took off during COVID for obvious reasons, right? It's a virtual visit from home, audio only, or like on like a portal, depending on how your provider has it set up. It can allow According to the Medicare waiver, it can allow a nurse practitioner, a therapist, and of course your physician, and even social workers to connect remotely and bill Medicare, right? So this is a good program for seniors. That's why I said I do believe that this will get approved once the budget is approved. The key benefit for home care clients that can't travel, right? Home care clients that can't travel. And remember, this also goes in line with the whole aging in place initiatives. Remember, I said because of the senior tsunami that's coming, everything is leading to aging in place, aging in place. So telehealth fits within that, fits in lines with that, right? All right, so the waiver expired on September the 30th when Congress didn't extend them, right? So the shutdown froze even the discussion of the renewals. So the waiver essentially ended on October the 1st. So why it matters to you if you are a home health care agency providers, clients may have to return to in-person appointments. I just said that, right? So they return to in-person appointments, right? But that's a good thing, right? That's a good thing, right? You want reasons to be able to interact with your client more. Oh, okay. You having a pain, you having discomfort, you got a bruise, you're feeling different from, month before, can't get on this video call with your doctor. Let's take you in. Let's schedule you appointment. We'll accompany you. We'll escort you, right? That's essential in non-medical home care services. That's why you need to know your scope of services. This is something we go over in the home care Kickstarter program, right? That's one of the first things. Know what services you are able to provide and how to provide them, right? Don't just say cookie cutter ADLs, cookie cutter ADLs. We help with cookie cutter ADLs, right? Because in something like this, your brain won't even function to say, "Boop, why don't I just go around and try to get more people to their doctor's appointment to get seen?" Right? We miss those opportunities, and that's why POUR stands for passing over opportunities repeatedly. We miss opportunities because we're stuck in our cookie cutter mindset, right? Of only what you're only thinking of what you can do based on the Facebook groups that you're in, right? All right, so agencies lose virtual follow-ups options that reduce travel time and boost efficiency, right? So on a home health side, right, an agency, this may hurt a home health agency because it's like, well, I have to actually take them into the doctors because the doctor is saying, oh, I won't renew that medication unless I see them in person. But on the home care side, this is really good because, like I said, it gives us more things to do, right? Um, Fewer telehealth touch points means less oversight between visits, possible health decline, and higher readmissions, right? So you definitely want to plug that in to your client, potential client, and even a physician. We don't want that person to have to go to the ER, right? For something that could have been addressed if they were able to see their doctor. All right. Okay, now hospital at home programs. I want to explain that a little bit more. Like I said, I love it in states like Texas. CMS initiative allow hospitals to treat certain patients at home with hospital level monitoring and nursing, right? So that essentially falls more underneath home health than home care. They use remote technology, a daily nurse or physician check in, and partner with, hospitals were partnering with home health agencies. right? So that was a good time if you are a home health agency, and because it's going to open back up to partner with hospitals. So a lot of times you guys go to these hospitals and you market your home care business, right? But you don't know how to partner with it. Partnership is the strategy that you're missing, right? Over 300 hospitals participated in the hospital at home program. You just need to find out if the hospital near you was one of those hospitals, right? Even if you're not a home health, which mostly benefits from this hospital at home program, you could still benefit as a home care agency by offering some home um, home assistive services with hospital at home services, because a lot of those people, the additional services that they would get around the clock, they're still also missing at home, right? So essentially the hospital home is like a visit. So they're still missing some essential parts of their well-being. And I definitely saw that they were really using this for treating cancer patients. So it would be beneficial if you go check out my feature training for the month on how to market to cancer patients, right? Okay, so this waiver, like the telehealth one, expired on the 30th. And so hospitals are now forced to pause or scale back in their program. So that means that any services will be done at the hospital, right? Um, it could be a sense of loss of revenue for some agencies that have partnered with some of these hospitals for the hospital at home initiative. They were contracted to provide the visit services. But again, that just means they can't bill Medicare, right? So if you are a home health agency, then you still should be able to, if you are credentialed, bill the insurance company. So what I like about, again, the hospital at home program, it was definitely a game changer. It proved that the whole program, that's why I believe it's going to be coming back, proves that patients recover better at home, which I always say, remember, I be on my Kendrick Lamar, even though fan, not a fan. That's why I always say home care, home health care, they're not like us, right? Why is the hospital trying to send them home? Why is the hospital trying to send them home? This hospital at home program works so well that hospitals are trying to send them home too. You guys think everybody wants to go into a facility. Even this program proved that even hospitals are saying patients recover better at home. So we're looking forward to that renewing. Okay, so here is what we're telling you to continually to do, and I'm going to answer some questions, right? All right. Remember what we said before is this is not the time to delay your billing, right? It's not the time to delay your billing. We talked about you need to be very frequent with your billing. Your billing needs to be, if not weekly, if you have a large population roster, you might want to even step it up. Some agencies are doing daily, every other day. If you're like, oh, I didn't realize I can do it that frequently. Yes, for some programs you can. For some programs you can. You can bill more frequently, right? Um, Continue to have that open communication with your clients, right? Even though no, claims are continually to get paid, you want to continue to have that open communication with your clients, the client's decision maker, the families, and telling them that being that we are on week, 2, I think Wednesday will be officially week 3, that you're continuing to monitor um, to continue to monitor what's going on and make it to ensure that it doesn't affect the flow of operations. If you if your clients use a home care software or even paper um, documentation that they have to sign or verify, this is a good time to encourage them to make sure that they are signing off on those time sheets or nurses notes or whatever that you need them to sign off on, so that you can make sure that there are no interruptions to the services and that the agency can continue to pay their staff in a timely manner. This is a good time to be transparent, but not too much, right? You want to tell them we've now moved to weekly billing, or we now moved to daily billing to ensure no interruptions, right? We're going to be we're monitoring this, and we will give you updates. I like to liken it. Have you ever been on a plane and you're like, why are we just sitting here, right? Why are we just sitting here? Why haven't we moved yet? Why are we just sitting on a tarmacs? And why haven't we moved yet? Why haven't we taken off? Right. And people are wondering, right? You're sitting down, the flight attendants are sitting down. You're like, okay, I guess I'm just going to keep using my phone, right? It's not until the pilot, the captain gets on and says, hey guys, this is what's going on. Do people go from wondering to knowing? So I like that type of communication. I like when you know what's going on. And it's like, sometimes they may say, hey, we had to get something replaced. So we were waiting for XYZ. I like that. That's the level of transparency I believe you should be having with your clients. Now, one of the things I teach my mentees to do is to have some form of company newsletter, company text message communication, email communication, right? So this should be regularly. And this is you putting on your home care CEO hat. This is you, or president. This is you communicating, right? Giving like a weekly update, right? And it should be meaningful. It shouldn't be long and lengthy. Your communication to your staff, your caregivers, your CNAs, your PSA, home health aides, or nurses, it's going to be a different letter from what you're communicating to your clients. You should have two different kinds of communication. My home health care agency, we have one thing that we were sending to the nurses, another thing that we're sending to the clients. They shouldn't be receiving the same thing, right? It's a difference. It's a different pep talk, right? So that's something you can do. So we're saying um, continue with the communication, continue with your billing. Don't lag. I don't care if you're saying, well, it's costing me more because I don't do my own billing. Um, I pay someone to do it for me. We want to get ahead of any potential remittance delays, right? Because remember, I just said CMS. Remember, I just said CMS is on reduced staff. They're on reduced staff, right? So how do you know if the person that's approving your claims only comes in twice a week now, or he or she has additional work? So don't mess up your cash flow. Don't mess up your reimbursement by doing that, right? Now, make sure you're looking over the claims that go through, making sure that they are uh, efficient, they're clear, it's a clean claim, right? Because another thing that might get delayed is if you have an appeal, right? So if you have an appeal because, hey, you guys paid me for 12 hours, but I should have got paid for 16 hours. Wow, you got to appeal that, right? So now you're missing out on 4 hours that you got to appeal. So because the administrative capacity is down, then this it's going to it may take a while for you to get that back, right? Right? Then you want to, if you're a larger home health care agency, if you want to be talking to your accountant or your CFO, your CPA, great, depending on who you have, and you want to be talking to them about um, ways to use your cash flow. If you were dipping into the pot regularly, doing owners draws, you want to seek advice on getting on a budget um, for cash flow, um, to make sure that there are no hiccups in your payroll for you and your staff, right? So I know when I had gotten after a large contract, I had gotten a new CFO, right? Accountant. He wasn't a CPA. He was an accountant. He had health. He had healthcare insurance uh, background. He was an insurance. I don't want to say commissioner or something like that for Humana in Texas, right? So I was so he blessing me. Like, that's all God be showing out. I'd be like, when I look back, I'd be like, dang, he sent me somebody that was an insurance. He was an insurance, and healthcare insurance. But anyway, um, he was like, he said something really, really essential to me that no one had told me in 8 years. This is my 8 years in business. Remember, I always tell you guys that you be looking for problems in year one, year two, and things may come up in year four. Things may come up in year six. Things may come up in year 10, right? And so he was like, Sean, um, I had a significant contract and cash flow, didn't have a problem with cash flow, money in the bank. I think at that point we had just hit like a little bit over 5 million in revenue, right? One contract had, I think, what an additional 1.4. So I always tell you guys, it's like levels, and I'm not a gamer, but that's how my mind process. Like, okay, I had gotten to the level of 2.3 million in my second year of business. Then I got to the 3 million level. I stayed in the 3 million level longer than I should have because shortly after my mentor passed away, and I didn't have a good mentor to tell me how to get out of that 3 million level. And then I hit the 4 million level. I was like, okay, this is cool. And then I started working on building my team better. And so of course that I invested a lot of money into good talent. And then when I hit the 5 million, between the 5 million and 6 million level, that's when I was introduced to this gentleman who, power of networking, ended up being my CFO. Didn't start off like that. He just started off auditing. He was like, hey, well, I can, take a outsider look of your books. He ended up being my CFO. Thank God for him. And one of the first things he encouraged me to do, which I'm plugging in now, if you're able to, is he was like, Sean, you need to get money when you don't need money. That was the advice he gave me. He said banks, uh, financial institutions, they're more willing to lend you money when you don't need it. And boy, was that the truth. I mean, my own business bank account saw um $20,000, $40,000, $60,000, $98,000 coming in per week on Medicaid bills alone per week. Yeah, I'm gonna get on my claims things. And they were still like, no, well, we'll just raise your credit line just a little bit. They were, I don't know. I don't know what kind of trickery some of these people have, but business credit, those lines, they were not as free as they may be now when I was starting. So money wasn't, it was not easy to get money. So you had to do a really, 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 really good job managing your money and then making sure you had good cash flow. Right. So he was like, Sean, I want you to I want you to get money, and that's my advice to you, when you don't need it. And because I didn't need it, the institution that I ended up getting, they convinced me to get a line of credit versus a loan. And boy, was that such a blessing to my business because I had like a $400,000, 300 to $400,000 line of credit that I could use for payroll, right? And they call it factoring. A lot of staffing agencies use this. And essentially, what that means is that with a loan, right, they give you everything up front. And then, just like a mortgage, you got to start paying on it, right? With the line of credit, I can say, you know what, I got this. I got this $60,000 payroll. I can't cover. Uh, Submit it to them. They send me the money, and then when I get paid, I can essentially just pay them back, or I can pay them in increments. I can pay them in increments, or I can pay them straight back just so I don't owe them anymore. Because whatever I owe them, that's the part that I'm paying interest on. I don't even know why I'm going down this rabbit hole, right? But essentially, communication to your client, fix your cash flow, talk to whoever is your financial person, fix your cash flow, you know, in the multitude of counselors, there is safety, right? Don't be afraid to talk to somebody. Don't just say, well, I've done this myself. Don't be afraid to talk to somebody and get advice, right? Right. Then you want to double check on any of these community partners that, like, Department of Aging, any nonprofit organizations, and you want to see if they are experiencing any pauses or gaps in care, right? Because as we're getting closer to um, as we're getting closer to like Thanksgiving, uh, if you provide a lot of respite services, those will, to me, be affected. Then you want to check eligibility, that EBV system. You want to check that regularly. Um, at one point, I had my staff checking every every day, right? If this scheduler had a roster of clients and this scheduler has a roster of clients, they checked it every day, right? Right? You want to be able to catch those, anybody dropping their eligibility or their eligibility getting affected. You want to catch those right away. And lastly, my advice is that if you're able to, or somebody in your office is able to, come up with a resource list for your clients. Um, Whether that's, local food banks, right? Just resource lists for the clients who might be affected on the other side, and maybe they don't have their SNAP benefits, right? They don't have certain funding. So, with that being said, that is my brief update. Um, and I'm going to create a list. Prioritize submitting your bills. Confirm. Oh, I forgot to say confirm pre-authorizations, right? Medicaid, insurance, Medicare, we have pre-authorizations. Don't don't do that short notice. Try to do your pre-authorizations, if you can, 2 weeks in advance. Okay. Try to see if you can preserve 2 to 4 weeks of cash to buffer any payroll um, uh, issues. That should be your cash flow guide, 2 to 4 weeks of cash buffer. Okay. Talked about communicating with your workers, your staff, communicating with the clients. Um, document, forgot about that one. Document everything. If you say, oh, there was a delay this day, keep a little log, print it out, print it out. Anything that was a interruption, service interruption, you called, nobody was available. Yeah, document that, right? You will need that for if you have to do any kind of appeals, right? And then continue to watch the news, watch as well as pray, as they say. And then when it passes, you will be in a good, you would have passed the storm, right? You'll be in a good position. Okay, I'll take questions for about 3 minutes and then I'm going to jump off and get ready for my home care Kickstarter mentorship. We're talking about client admissions tonight, uh, how to do one effectively, and how to make it a operable system in your business. Anybody have any questions? We bill weekly and in arrears. Okay, cool. Cool. Business just stagnant. Okay. How long have you been in business? Thank you for the follows, guys. Can't wait to start my business. Don't be scared. Thank you. Don't be scared. All right. I think I'm just going up. Make sure I didn't miss anything from up top. And then I'm going to come back down. Oh, okay, I got everything from up top. You got Medicaid approved. Congratulations, 4 years. If you'd like to have a call, click the link in my bio. Where are you located? Naja reads. Oh, you're more than welcome, Marcia. Okay. Does any of that make any sense to you, what we just said? And I'm going to repeat it. What your home health care agency needs to be doing. This is your verbal checklist. Prioritize submitting. Oh, hey, Beyond Mobile Health. Thank you so much. Prioritize submitting all your claims, pending claims, your weekly claims, monitor your remittance report. Again, even if you have someone else doing your billing, when you get that remittance, open it up, download it, go line by line. You need to work on your time management, set aside time to go over your remittance report, make sure that everything is matching. If you got any need pre-authorization set to expire, make sure you're doing them a week to 2, preferably in advance. Make sure you're up to date with any MCO agreements, right? Try to preserve 2 to 4 weeks of cash for your payroll, for cash flow. Review your accounts receivables closely. Reassure your workers, your staff, that coverage isn't going away, that the agency is still able to pay its bills, to include payroll. Communicate with clients. let clients and families know that you are still able to provide the service and that the government shutdown has not affected the agency. Thank you so much. Document everything, track if you had any delayed payments, any service interruptions, any denials. Remember your tracking so you can use any information for an appeal. Places like SBA loans, right? They're not giving out any funding. So that comment I made about getting money when you have money, SBA loans wouldn't be the place to go. Some of those grants that you guys say, have you guys noticed that since the federal government shut down, you don't see a lot of people talking about what grants to apply for this month? That's why you can't have your business dependent on grants alone, right? And then continue to watch the legislation, monitor the news, even locally. Samantha, I created everything, business plan, own an office, but don't know where to go from here. Where are you located? I mentor, are you mentioning skilled or non-skilled? I mentioned both. I mentioned both. Oh, thank you so much. Yep, don't forget to tap the screen. Ohio. I think that's a longer conversation, Naja, because Ohio, I don't know where in Ohio you're located. I don't know what you're doing or what you haven't done for your business to be stagnant. I don't know if you have one client, zero clients. There's a lot of things I don't know. So that blanket statement, my business is stagnant, that sounds like a couple of things, if I was doing a quick diagnosis. But I would really need to get more information because I don't know how consistent you are. I don't know how consistent you are with getting yourself out there, getting your business out there. I have 2 different mentorship programs because I do have to get off. Well, I will encourage you to go on over to my Savvy Business Chick YouTube channel and look up Kickstarter, right? My Kickstarter program is ideal if you want to get started, right? It includes all things, including your policies and procedures. We do skilled and unskilled. Thank you so much for the follow. And because it goes several weeks, so we started in September. This is our last one for this year. We started in September where people have submitted their application and now we're learning how to operate our business. I'm always saying there are people that are out here to help you, but so far all I see is that they help you with the documentation. So the Kickstarter goes beyond that. So we're now into operations. We are going over client care, personnel. I got asked a question earlier today by someone who has a consultant. And to me, it would have seemed like they would already know that answer. They said, oh, does the staff need to be fingerprinted before they start working? And I said, yeah, they do. And I quickly answered that question and just, encouraged them to go and read their policies and procedures. But if you had a training, right, that not only told you what to do when you're hiring, when you're orienting, what needs to go in your files, right? Wouldn't you feel a little bit more at ease that you know what you're to do, and then you can go back to that training and rewatch it at any time if you needed a refresher. Then we go over billing, payroll, scheduling, and also marketing, how to get your first client. Then we have the next step program that just started last Monday. That's for people who they are ready for their next step. They're licensed, but they did not have the same opportunity as my Kickstarter. They got policies, procedures, application completed, but they didn't get any training. So they're looking for the next step. What do I do now? Right. And so they fit in perfectly when we started the client care section because they don't know what to do when they get the first client, what form to use. Right. And so the next step goes about 6 to 7 weeks, right? 6 to 7 weeks. And then they're in the mentorship program as well. And then last one we have going on right now is strictly marketing. And I'm literally spoon feeding my mentees their marketing strategy for the end of the year, the holidays, and the winter. And that's what we have going on right now. And I'm going to take a break in December because I'm literally giving out so much of myself to these 3 different groups. I think I'm going to take a nice little break, me and the kids, me and the family, me and my family to take a nice little break because it definitely can be a bit draining, to come on here and make sure you guys are up to date and to also make sure my mentees are, staying accountable, doing what they're supposed to do, so they can get the results that I know they can get. I got so many clients. I got so many clients around this time of the year that I'm looking forward to you guys hearing those testimonies. And this is a good group. I love these ladies. I got one guy. I love them. Like every time they send a message in a WhatsApp group, I'm like, oh my gosh. I think for the first time, I'm really starting to see a couple of people who have that same energy as me when I first started. And I don't see that very often. So it makes me want to give them more. So the startup kit, how is it for the marketing part only? The marketing part only is essentially your marketing strategy online and traditional. Like I said, we get weekly your weekly marketing plan activities, and we do a live every. That one is $9.99. That one is $9.99. That one is $9.99. Well, again, I am about to get ready to get off here, guys, and take care. Yes, thanks, Francine. Um, yes. All right. Have a good one. I'm gonna finish getting ready for them. We're gonna talk tonight. We're gonna talk about how to deal with objections, right? What if you're right across the table from someone, you just presented um your home care fees, right? And they're like, oh yeah, so what do we sign up? Right? And you show them how much it's gonna cost. And they say, oh, we can't afford this. How to deal with objections, how to convert them into a client. Yeah, I'm excited about that. It's the last part of our system. It's the last part of our system. I'm really, really excited to do that. Let me show you guys one last thing, I promise. Is it I still up here? This is a good little. Depends on your state. Depends on your state. So I think I told you guys I have something special for. Let's not let me pull it up too fast. So I'll go. I'll do a mini video later. Okay. Take care, guys. Let me go finish getting this together so I can have my slide, because my flip chart, I'm out of paper. Best thing you can do is email me at mentor@savvybusinesschick.com. Take care. Bye. Bye, guys.